you really have to look at the pace at which it's spreading, which is much faster even than the US. And so if India continues down that path, in the coming weeks, we will see it becoming the country that has the highest number of COVID-19 cases in the world as well. The country has massively ramped up testing over the past 2 weeks, so more than 1 million tests have been conducted every single day. I've heard, government functionaries sort of saying, we're doing more tests than anyone else in the world, and that's why we're discovering more cases. Well, the other side of that is that even at that rate of more than 1 million tests a day, that's a really small fraction of India's population which has been screened so far. And so actually, it's possible that there are cases that we haven't yet discovered, that the number is actually larger, as well as the counting of deaths in India is not watertight as well. So I think most people agree that the numbers you're seeing out there are underreported. The government does like to point out that India has a low death rate, and public health experts agree with this assessment, that the number of people dying of COVID-19 in India compared to the size of its population is a lot lower than we've seen in some of the countries really badly hit, including the UK, the US and Brazil. We don't know exactly why that's the case right now. And the thing is, if it continues on that upward curve, even at a low death rate, that's still hundreds of millions of Indian lives at risk.
That's our correspondent in Delhi. Let's speak to Dr. Ramanan Laxminarayan, who's an economist and epidemiologist, and joins us live now on the programme. Thank you so much for being with us. How worrying are the numbers we're seeing in India? We've had, I think, for 7 straight days, more than 75,000 cases each of those days. How worrying is that?
So this was always to be expected, given India's population and the fact that with the removal of the lockdown measures, which were the only things that were keeping the virus in check, the transmission has really speeded up quite a bit. And India is on a very fast upward trajectory with respect to cases. As was just mentioned, there's probably a serious undercount, both in terms of cases as well as in deaths. And I think India is performing just about as expected, given the capacity of its health system.
In terms of what you just said about underreporting, I know it's a guess, but what is the best guess in terms of the proportion of cases you're actually finding to actually the reality on the ground?
So the latest serological surveys, and serological surveys look at the numbers of people who have been exposed to infection in the past. The estimate is that the reported infections, of which we're now at 4.2 million, underestimates the true infection by a factor of anywhere between 50 to 100. That's a pretty large difference, but that's not unexpected, given that testing levels in India have been extremely low. Even today, India is 119th or 120th in the world in terms of tests per capita, and it's much higher in terms of deaths per capita and also in terms of number of cases per capita. So if you don't test,
how much of a problem is that, testing and the low amounts of testing?
So the low amounts of testing are no longer a problem just for counting cases, because no one's really keeping track of these reported infections. I know it's of significant interest to media, but really from a real standpoint, that's not the way to keep track of the epidemic. However, if you don't test, then people don't know that they're COVID positive, and then they're transmitting the infection to people in their families, in the workplaces, and so forth.
There was a very strict lockdown. That has been eased. We've seen the impact on GDP, 24%. In terms of what other measures going forward the Indian government should consider, what would be the best advice, do you think?
Well, I would say keep increasing the testing, do more of the RT-PCR testing. But frankly, this was the best that India could do. It perhaps could have done more testing in the early days of the epidemic in March. But the lockdown was really the only significant measure that the government was able to undertake to slow down the virus. And at this point, the virus is completely unconstrained and is spreading freely, both in urban and in rural India.
Which is, of course, extremely worrying for the authorities. Doctor, we have to leave it there, but thanks for joining us on the programme.